So you think you have a rotator cuff tear? We're going to help you figure that out. Welcome back, everyone, to another episode of Twin Stock Therapy. I'm Adam.
And I'm Aaron.
And we are twin brothers that have 30 years combined experience in massage therapy, physical therapy, and athletic training.
So today's video about rotator cuff tears. First, let's go over a little bit of anatomy. So the rotator cuff gets the name because the tendons together from a side view, if we were to dissect and look at the way they attach around the shoulder joint or the top of the humerus, it creates pretty much what looks like a shirt cuff. And so that's why it's called rotator cuff. We often hear a lot of funny nicknames like tater cuff, rotator, rotary cuff, tater cup is one I heard in another region that was kind of funny, but it's a rotator cuff, so think just cuff of a sleeve on a shirt. And those four muscles consist of the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. We want to focus mainly on the supraspinatus muscle because out of those four, it's pretty rare that the other ones will tear or fray. It can happen, but most likely that supraspinatus muscle is the one that frays. So Adam, why don't you tell us a little bit about who's most susceptible for a rotator cuff tear and what are the likely causes of a rotator cuff tear?
So most people that are susceptible to a rotator cuff are usually middle age and higher age-wise because they've had a lot of wear and tear. People that have poor posture and people that have very repetitive motion jobs usually are the main culprits for a torn rotator cuff. And when we're talking about the supraspinatus, I'll have Aaron turn to the side. That muscle is in the top of your shoulder blade, and there's a fossa, they call it, like a dip in the bone, and that supraspinatus fills in that fossa and it goes underneath your acromion process that flares off of the shoulder blade and attaches to your collarbone. So you'll hear that joint is referred to as the AC joint. That's where that's at. But that tendon for the supraspinatus dives under the acromion process and attaches on the top of the humerus. And it does the first 30 degrees of abduction. So what happens when we have internally rotated shoulders and a forward head posture, our shoulder doesn't articulate properly and it starts impinging on that tendon for supraspinatus, with causing fraying, and over years of doing that, then you end up getting a tear significant enough to need repair.
Next, we're going to talk about some conservative means of treatment for rotator cuff pain. Some likely signs and symptoms you might experience that could indicate you have a rotator cuff tear. We'll also talk about when you should consider the surgical treatment route, and then we will discuss a couple of exercises to help limit the increase of a tear or to help decrease the pain from a rotator cuff tear. All right, Adam, so when we're talking about rotator cuff tears, what are some of the signs and symptoms someone might experience when they're dealing with rotator cuff tear pain and need to consider whether or not they do have a rotator cuff tear?
So usually you're going to have shoulder pain. A lot of times you'll have pain sleeping at night if you're on your shoulder. Some other symptoms is usually when you're activating that supraspinatus muscle. If you try to reach for something above 90 degrees, you're going to have a hard time doing that. That's when you have a tear that might be significant enough that might need surgery. If you just have pain and motion activates a little bit more pain, but you don't feel a tremendous loss of strength and you're still able to go through full range, you might have a partial thickness tear that can be treated conservatively with exercise from a practitioner, a PT, an athletic trainer.
And the conservative route, as long as it's successful and the tear is not a full thickness or it hasn't progressed to the point that it's causing pain with very limited motion and adjustments to your activities of daily living, conservative treatment with therapeutic exercise is a great means of treating, so you don't have to deal with that long recovery process from surgery and the risk of potentially the surgery not being successful. And that brings us to our next point. If you get to a certain age or a certain point where that tendon has become a full thickness tear, then surgery is really the best route. The best way to tell that is to be evaluated by an orthopedic physician or orthopedic surgeon or even another sports medicine professional, athletic trainer, physical therapist. They'll be able to guide you and refer you to orthopedic specialist, surgeon, to see if surgery is really that best route. I think one of the biggest mistakes we see is sometimes maybe someone jumps into surgery too early. And that can be indicative if a younger person does have a tear and they're an athlete and they're still trying to be competitive, maybe surgery is a good option for them. But then the biggest thing I see is probably more often the case is when an elderly person does not want to have surgery. They don't want that lengthy recovery time, so they put off surgery way too long. And so we don't want to do that either. We want to make sure we can have the surgery be completed and be successful so the elderly person can get back to their activities of daily living. You want to be able to reach up and grab a coffee cup out of your cabinet without the weight of the cup or just the action of lifting your arm give you so much pain that you start avoiding that issue. Because another thing that we haven't discussed, but the possibility of developing a frozen shoulder by not moving our shoulder joint, and that in itself could end up resulting in a surgical procedure to just remove scar tissue just to get the mobility back. So lastly, I think what we should talk about is some of those exercises that we could do with the conservative treatment. So Adam, do you want to talk about the chin tuck exercises and just the wall angels as far as good exercises to help try to fix that posture and limit the fraying and the stress on that supraspinatus tendon?
Yeah, so we already covered some shoulder exercise videos in a previous video that you guys can watch. So we're not going to rehash a lot of shoulder specific exercises for strengthening. We're going to focus on posture. So a chin tuck is where you stand to your side, and it's where you just draw your chin straight back. That's going to help decrease a forward head posture, because a forward head posture will get the shoulders to follow. Next, you can do wall angels. I really love the wall angel exercise. It's one of my favorite exercises to show people, and that is just simply getting up against the wall. The waist and above goes against the wall. So your head, shoulders, elbows, wrists, and your waist should touch the wall. Your feet don't have to be up against the wall, and you just simply are in that frontal plane of motion is what that puts you in. And then you go up and down like a snow angel. That's why we call them wall angels. You do 10 to 15 reps of this, and this will help articulate the shoulder blades properly on the back of the rib cage, and it will integrate that neurology in that motion, talking from the nerves to the muscles to help you to hold better posture after you do them. All right, and I think it's important to mention too, whatever you decide, whether you decide to have surgery or not have surgery, it is important, if you're going to hold off on surgery, that you do get your shoulder checked out and make a decision with a healthcare practitioner, because the last thing you want is a full thickness tear. You wait for a long time. Like, I personally know people that have waited way too long. They decided they need surgery finally because it's come to that point, and the doctor has nothing to reattach to the bone because the muscles and tendons have atrophied so much that they're just not even there. So whether you decide to have surgery or not, you need to make that decision right away. And then if you want to go the conservative route, start that right away so you can get that strength built up.
Yeah. We let that fear of finding out whether we have a tear or whether we're going to be told that we need surgery keep us from going and seeing anybody. So see someone, find out what your options are, and then take action. Okay, that's it for this video over the rotator cuff tear, ways to treat it, and conservative versus invasive treatment options, a little bit of anatomy, and we hope these videos are helping you with a few things to do to help with pain in certain areas of the body. As always, please give this video a like, subscribe to our YouTube channel, hit the bell notification so you can get notified when a new video is posted, and then if you have any questions, comment in the comment section below this video, or submit a question or a comment to us at our email address at twinstalktherapy@gmail.com, and we will see you in the next one.
Yep, thanks for watching.